at all. Yeah, thanks. It's great to be here. I'm really delighted to be getting this over and done with, to be honest, so I'm glad I'm up. My name is Jo Donohoe. I'm the Mental Health Promotion Manager with Mental Health Ireland. And part of the portfolio of the work that I do, the Woodlands for Health programme, so the Woodlands for Health programme comes under my portfolio. I don't coordinate it. We have someone in place. We have someone who's actually going to be in place, Sarah Hergens, who's sitting over there, her hand is up. So she's going to be in post in about 2 weeks. And I just wanted to talk, I suppose, I am another person who didn't take the opportunity to do that funny sounding presentation style. I opened the email on Sunday night. I had to work at the weekend because I had 3 presentations this week, so I have bowed out of that, so I'm doing a normal presentation with the clicker, so apologies. Just to say as well that one of my colleagues, Dr. Rhonda Barron, did have a look at my slides and said they were okay. She is our research person, so I said we're good to go. So just want to talk a little bit about, I suppose, data, and I took this very literally. It was like, how do we use data? And using the example of the Woodlands for Health programme. So just to explain what Woodlands for Health is, it's a 12-week woodlands-based walk, okay, and it's for people who are linked to mental health services. It started in 2012. It was piloted in Wicklow, in County Wicklow here actually, as a programme, and it's from an evidence-based programme in Scotland called Branching Out, and I've already met someone who's involved in Branching Out. We were trying to have a chat over dinner, but we will be having a chat. So I think from our perspective, the fact that it was already tested in Scotland and worked was something, I suppose, that adds a lot of weight. And it's a programme that's done here in partnership with Quilcha, Get Ireland Walking and Mental Health Ireland. So I suppose when we look at data and we're using the model of the Woodlands, and I think just to mirror what some people have said already, is this is a programme that's done in partnership. So at a local level, the Woodlands for Health programme is managed by local steering groups. So it's very much a local programme. So the sports partners are involved. You have local mental health associations, you have occupational therapists, and they come together and organise this locally. As of 2024, we have a Woodlands for Health programme in every county. So that's a huge, and that has grown in 2 years from, I think it was 17 counties. We currently, last year we had 42 Woodlands for Health programmes run across the country, which is amazing. And that couldn't happen again in partnership. And to be honest, when Mental Health Ireland, when we say that we're partnering with Quilcha, people are kind of going, Mental Health Ireland and Quilcha, but that does come down to the benefits of woodlands, being in nature, and the same with Get Ireland Walk and the benefits of walking and being active. So, why do we walk? This is me down at River Barrow if I can grab a lunchtime or in the evening when I'm absolutely wrecked. Going out for my daily walk, thinking, why am I doing this? I have a 4.5-year-old, and I have it drilled into him that, maybe I did have a cream cake and I want to fit into the jeans, and that's one of the reasons I walk. But I also walk for my head, which is really important. And it's that piece of like, people walk for different reasons. People walk for the chats. People walk to catch up on the news and they listen to podcasts. And then why do we walk in woodlands? Do you know? Do we hug them? Do we look at them? Is it just because it's in our back door? Do we do it because we want to relax? I know myself, I had a bit of a health scare late last year. I had an operation and I was absolutely bet after it, physically and emotionally. And I was having a really bad day, and there's a looped walk in a wooded area near me, and I went up and I literally came home a different woman. And I rang the previous Woodlands for Health coordinator actually, she was in hospital, and I rang her and I said, you'll never guess what happened, I feel great, So it's just different reasons, different for different people. And then I suppose the question is, how do we know? Woodlands for Health is a walking programme. It's a led walking programme. It's a walking programme for people who have experienced mental health challenges, who are linked to the mental health services. It's run at a local level, and we do it in the woodlands. But how do we know it's working? And that's, I suppose, what we're here to talk about. So what we do with Woodlands is we do qualitative and quantitative data collection, and we do that in a number of different ways. We do pre and post participant surveys, and that's really important because what a person says at the beginning of the programme and what a person says at the end of the programme is quite often. Well, we want it to be different, to be honest. You know, we want to see that progression, and we want, I suppose it's really important to get the feedback of the participants. We have weekly programme data, so, you know, who's turning up? What was the weather like? What time of the year was the programme being run? You know, was it being run during the winter, run during the summer? And that's data that we have to look at. The informal mechanisms then is really important. So it's the feedback, it's the anecdotal stuff, it's the what someone is saying when they're getting into the bus after a walk, or what someone has said getting out of the bus before the walk. And that information is rich. You know, it may not be formal. Someone might not write something down on a sheet of paper, but they might say it to a person, and we collect that. Our process evaluation then, it's how are we running the Woodlands for Health? So what is it costing us? What are the organisers on the ground saying? You know, what are the issues with the transport? What are the issues that are coming up? And how can we learn from those and progress it? And then we also have formal evaluations. The formal is the big stuff, you know, it's the thing that we can use, it's the piece that we use to I suppose, look at the sustainability of the programme. So we've had 2 formal evaluations of the Woodlands for Health. The first was in 2014, and the results of that were that there was 75% improvement in the mood of the participants of that Woodlands programme, 66% improvement in sleep, and 82% in thoughts of suicide had declined. So they're huge. When you see that, you think, wow, you know, when I was doing up the presentation Sunday, I literally was, Jesus, you know, we're obviously this is the meat, this is the piece that keeps you going with the Woodlands. The second evaluation happened in 2020, and self-reported well-being had increased by 31%. And then nature connectedness had increased by 11%. And that was a new, I suppose, when you talk about nature connectedness to participants, it's probably not something in 2014 that we even looked at measuring. So I suppose it's well and good that we have the data, you know, and we can have all the data, and we can see that people's sleep is being improved or their mood is being improved. But how does that affect, or how does that benefit, or how does that progress the work that we're doing? So simply, there, lovely picture of you, Dahi, there. Yeah, you had to get Dahi in. So essentially what the data does is it supports the direction of the programme. It helps us to make decisions, but those decisions are evidence-based decisions, and that's really important. So the data ensures that the fidelity of the programme is being held. So when we talk about the process evaluation, when we go out and we talk to the organisers, and they tell us that, well, actually the programme that's being run in such a county is over 8 weeks, not 12 weeks. So that's not a Woodlands programme. A Woodlands programme is over 12 weeks. It has to be adapted, but we need to then look at the figures of that. So the fidelity of this programme is really important. The expansion I mentioned, so we now have the Woodlands for Health programme in 26 counties, and that is as a result of collecting the data. So we were able to tweak, we were able to learn from other programmes. The sustainability, and that essentially is, you know, the sustainability on the ground. It's having the data, being able to work at a local level with the local steering groups, but it's also about creating those partnerships. And because we had collected the data, Mental Health Ireland, Get Ireland Walking and Quilcha essentially put money on the table and said, right, you know, obviously we're hitting the mark here with this as a programme, this is working, let's put our money where our mouth is, and let's pay for someone to coordinate and grow this programme. So the sustainability of the data is needed for that. And then the participant benefits, and this is really what it all comes down to, essentially, is we know that the mental health outcomes of the participants are improving. So we know that there is mental health outcomes, and then that comes back to everything else. That comes back to Quilcha knowing, you know, that they're doing something. It comes back to Get Ireland Walk, and it comes back to Mental Health Ireland. It comes back to the steering group. It comes back to a volunteer walk leader who has to leave their home and come out on a rainy day and who says, well, the mental health outcomes of these participants is being improved. And this is just, I suppose, woodlands in pictures. Just wants to give people a sense of what woodlands looks like. It's just people walking in woods, but it's so much more than that. Yeah. Great. Thanks a million. Cheers.